Hey, my name is Dr. Cozy, and look at that. How long has that been there? Okay. Is it painful? Yeah, it looks like it, huh? Okay. Have you tried to pull it out at all? Okay. Yeah, if your body is giving you a strong pain response, it's often a sign to back off. Really quickly, sorry, can I just get you to verify for me your name and date of birth? Perfect, okay. Have you been seeing any kind of bleeding or drainage from your ear? Okay. Any drainage down your throat? Any postnasal drip sensation? How about any vertigo, dizziness? How about any diminished hearing? Any fever, chills, or night sweats? Okay, good. And on a scale of 1 to 10, 1 being like just like a paper cut, 10 being absolutely excruciating, like you can't sleep, how would you rate your pain? Right. Just taking a look here. Really quickly to start, I just want to take a look in your throat, okay? Can I get you to open? Perfect, okay. Just need to excuse me, rule out the presence of any drainage coming from the ear. Have you had any throat soreness? I'm going to be gently palpating around the ear, the outside, if that's okay. Just making sure that I don't see any worrying signs. Is that okay? Is it painful? Okay. Just serious face when I'm concentrating. I'm not feeling any kind of swelling outside of the ear. Or any involvement of the external cartilage, which is good. I'm going to take a look inside of your other ear. Sometimes when something's going on with one side of the body, the other side will do some things to compensate. So seeing anything that would strike me as being abnormal here. Not seeing any fluid or signs of irritation like redness or any noticeable swelling. Just gonna shine my light. Just to see. Let's take this off. Let's see if there's anything. Noteworthy here that would indicate any kind of bleeding or drainage. I'm not seeing anything. Okay, I'm going to palpate along your jaw and down your throat, just feeling for any sign of inflammation, any lymph node involvement. And I'm also going to palpate your sinuses on your face, if that's okay. Again, I'm just looking for any signs of drainage or infectious process because the body does not like foreign objects. Sorry. Place my fingers on either side of your nose here. I'm sorry if this is awkward. Is this painful or is it causing any kind of pressure? Just gonna tap on your forehead gently. And any pain with that? Great. And then just a moment, I just want to see if any of my palpating or tapping or any of that has encouraged any kind of drainage or bleeding. Oh dear. There we go. Sometimes these are a bit persnickety. And not seeing anything different. Just a bit of some red and irritated skin. Okay. I'm going to try and irrigate the ear, okay, and see if we can't encourage that Q-tip to slide out. If that doesn't work, then we'll try something else, but let's start with the simplest thing. So I'm gonna grab a drape here. I'm going to just tuck this into your shirt. Just like so. This over your shoulder. Okay. Okay, so I have my little basin here, okay? I'm gonna place this on your cheek and it should help and catch any drips, but just in case we miss any, so we have the straight board. So I'm not going to be lodging this into your ear at all. I'm just gonna very lightly squirt and try and help and lubricate the skin here. Very gently here. Sorry, I trailed off. To see if we can't doing okay. Yeah, sorry, I know this is intense. Okay, nope. Alright, I'm gonna remove the drape here really quick. So what I'm going to do is I'm going to have you lie down on your side, okay? And I'm going to actually grab some sterile towels here. This way, if we have any kind of drips, it'll keep them from getting onto your face or your clothing. Okay. So what we're going to do is have you lie down on your side. I'm going to administer some drops to see if perhaps we can loosen some things up. These drops are generally used for breaking up earwax. So I'm thinking that they might help and release the hold on the Q-tip. Okay. Okay. So let's get you situated here. All right. So, are you okay lying in this position? Okay. Good. So, first thing I'm going to do is just get these ear drops going here. This isn't going to be painful at all, okay? Just kind of tickly. So. Let's try it again. I did get some wax out of here. tracer here. All right. Do one more. This is going to just sort of clean it off. It'll drain as soon as you sit up. Okay. Looks like we're good, so we can get you sitting back up here. All right. So, how are you feeling now? You feeling dizzy at all? A little bit sore? Okay. That is to be expected. I'm gonna take a look inside of your ear, okay? And I want to see the state of things at this point. So, feel me slide my otoscope in. Is this okay? Is it painful? Okay, I'll try and be quick. I am seeing a good bit of irritation and redness inside of the ear here. A bit of bleeding. gonna look at the other side to compare. That's okay on this side. Okay. This side looks fine. I'm not seeing anything to be concerned about. I just wanted to take a look at your eardrum on this side for comparison purposes. So, okay. So what I am going to do is actually take a look with a different otoscope. And this one has something called, get a different one. There we go, okay. So this one has something called an insufflator bulb, which allows me to blow a puff of air through the otoscope speculum here, and that way we're able to see if there's any kind of fluid, any blood, drainage, anything stuck behind the eardrum, which can cause an infection. So we just want to make sure. So make sure I get us in the correct position here. Okay. And I'm gonna feel a puff of air here. Your eardrum is moving with its normal range of motion, so I think that rules out any fluid trapped. I am seeing just a little bit of residual dried blood inside, so I'm gonna irrigate that out, okay? So we will tuck this into your sleeve again, or into your shirt, collar of your shirt, not your sleeve. Ay, ay, ay. It's been a long day. slide it in right here, okay? Pieces here that are stuck. Quick little sweep of the other ear just to keep you balanced. How are you feeling? Yeah, it's expected that you're going to feel a little bit sore. So you'll want to take it easy on your ears, okay? That means I would avoid any kind of loud music, wearing any earphones, particularly earbuds, giving your ear a chance to heal. And considering that there was a perforation to the eardrum, you'll definitely want to protect it when you're in the shower. We actually, in our pharmacy downstairs, have some plastic ear covers that you can buy that just slip over the ears to protect them from getting water inside. You don't need to protect both, just the right one, okay? But we really want to keep that area clean and dry as much as possible, while also reducing any sort of excessive vibration of the membrane, because that's how it functions. It vibrates in response to sounds. Okay. I'm going to prescribe you 2 medications here. Just want to sure we don't have any allergies. Okay. So nothing that would be a problem. So first I'm going to prescribe you an antibiotic because, like I said before, the body does not like foreign objects, and at times foreign objects can introduce bacteria into the system. So that way we can protect you just in case. I'm also going to prescribe you some ear drops, alright, that are going to help and encourage healing of the eardrum. And then along with that, I would like you to use anti-inflammatories. So it can be naproxen, Advil, ibuprofen. You want to take those every 8 hours with food, not on an empty stomach, alright? And then I would like you to come back in a week, and we will follow up and re-examine you at that time. Make sure that you're healing up okay. Okay, so then let me just... Alright, so we will get those called in for you. Do you have any questions about the medication? Okay. Well, I did prescribe you a supply for 1 week, okay? So it'll be out by the time you return to clinic and with your follow-up. And at that point, if we need to prescribe more medication, we'll do so, but I want to reassess first, okay? Okay, let's get this drape off of you, because I'm sure you don't want to go home with it. make sure that you stop by the front desk so that way you can get your appointment scheduled. I will actually go out there and make sure that they hold a spot for you, okay? We do fill it pretty quickly, so there may not be a whole ton of options. So I just ask that you try and make it work as best as you can. We will do what we can to accommodate you, okay? Okay. And I'm actually going to give you a call tonight and check in and see how you're doing. So if you do happen to think of any questions, we can talk later tonight as well. Okay. It was really nice to meet you. I'm glad we got that out. Hopefully I'll start feeling better really quickly.